COVID-19 isn't just a public health issue, but also an economic and political one. As we learn to live with the disease for some time, how do we get used to new arrangements in our daily lives? How prepared should we be for a different future? Mrs. Biola Ajenifuja is a clinical pharmacist, chief pharmacist with Gwarinpa General Hospital, the FCTA, Abuja. She joins us from our Abuja studios. Welcome to the program. First, let me begin by asking what your reaction is to the Lagos State government going back on its earlier announcement to open worship houses.
Yeah, it's a welcome development which is coming at the rightest time, if there's such word. Because if we look at the epic curve, it's not flattening. Rather, we're having more cases. So it's better the religious center remain closed for now while we tackle the issue of the rising cases of COVID-19. Then when we get to the flattening of the curve, then we can start thinking of reopening the worship centers. So it is coming at the right time to me.
Another issue fueling community transmission, we understand, is interstate travels, and there's been mixed levels of compliance across the country and also compliance to the precautionary measures. When you look at states and their efforts so far responding to the COVID-19 pandemic, how would you say they're doing?
Yeah, I think the security agencies need to tighten their grip more on the interstate ban, because there are still people moving in and out of states. And this is evident by, I have people close to me that have been somewhere, been to other states. So it means that the ban is not really very effective. So more needs to be done to ban the interstate movement so that we can contain this. Because some people are asymptomatic, so moving to other states, they tend to go and spread it in the other state. But when you remain where you are, it's easy to contain. So I think we need to do more on the interstate ban to reduce the significant high cases that we're recording now. So they need to tighten the grip more on interstate movement.
So, Mrs. Ajenifuja, we're having Lagos doing a turnaround, saying, okay, halt churches, worship centers for now. Do you see the federal government taking a step back again, saying as some of the measures they put in place aren't really as strong or working?
Yeah, I think they will need to really assess the situation. Need to look at the worship centers that have been opened. Are they complying with the guidelines? Are all the precautionary measures put in place? Then we need to look at the figures in FCT. Though the figures are erratic, not really following a particular pattern, you see cases today, less cases tomorrow, then high cases. So it's not really following a straight pattern. So I think we need to reassess the situation to look at the worship centers to see if they are complying with these guidelines. And if they are complying with it, then we need to sit down back and see if we should continue in that line or if we need to increase more precautionary measures in these worship centers for us to reduce these cases of COVID-19.
All right, Mrs. Biola Ajenifuja, clinical pharmacist, Gwarinpa General Hospital, Abuja. Thank you for joining us on the program.
Thank you very much.